Good evening, everyone. Thanks for coming again. For those of you who have been watching and joining, we are working this week on the risk factors for pregnancy. We talked earlier about the number of deaths that women who are dying in childbirth in the first year after. And looking at the risk factors, the goal of this series is to help families to be able to understand themselves, know yourselves, understand the health system, and to be able to take charge so that you are more engaged with the informed decision making that is occurring. We have looked at three other risk factors, and tonight we're going to look at risk factors for cardiac disease in pregnancy. Cardiac disease in pregnancy is going to be the third most prominent reason for maternal deaths in the United States. And by the time we start to add in blood clots and cardiomegaly, it ends up being a major problem in regard to deaths for women. So let's review these things tonight. It helps us to go back to understand why it's so important to understand and know your family history, your own medical history, and also what occurred in the previous pregnancy. All these things will make some difference in regard to being able to manage and work with the health system related to cardiac disease. So let's continue. Cardiac disease it causes 13% of maternal deaths in the United States. And along with that, by the time we add blood clots and cardiomegaly, it's going to make this one of the top causes for why women are dying. And blood clots are related to cardiac disease in pregnancy. And cardiomegaly is actually a disease of the heart muscle itself. So it's important to take a look at what is causing this. So once again, family history, your past medical history, your pregnancy history are important items to bring with you when you go for your preconception, or what we would call your pre-pregnancy checkup visit, to make sure, look at your health, see where things are, and help you to prepare yourself for a healthy pregnancy with good outcomes for mother and for baby. Cardiac disease is responsible for about 33% of pregnancy-related deaths. Pregnancy-related deaths are those deaths that occur up until 1 year, during and 1 year after the mother has had her baby. It complicates 25% of all pregnancies that are happening. And folks who are Black have a much higher risk than Hispanic and white populations, 3 times the risk as those populations. And risk factors for pregnancy-induced death caused by cardiac problems are high blood pressure, obesity, and women being over the age of 40. If we go back to the original presentation that I did on maternal mortality and the underlying causes, and looking at the number of deaths that are occurring, we saw that women over 40, 300 out of 100,000 women were dying for pregnancy-related deaths. So that's a large, large number. What happens in the body during pregnancy is we are now having to grow a whole human being. And so the heart increases the amount of fluid that it is going to pump through the heart by anywhere from 40 to 50%. The other thing is the heart rate will increase by 10 to 20 beats per minute. And the amount of blood that's being put out by the heart increases by about 40 to 50% by the time that the mom is 6 to 7 months pregnant, up until 8 months pregnancy. So this is why there's so many changes going on in the heart to be able to provide the blood supply to the placenta, to the uterus, the entire body. This is what is going on. And this is why if you're having heart problems, that this gets pretty much exaggerated during pregnancy. The risk factors. If you have any pre-existing risk factors, such as any congenital heart disease, if you have any congenital heart disease, those things will put you more at risk. If we've had any kind of high blood pressure prior to the pregnancy, or high blood pressure called gestational hypertension that develops during the pregnancy, then this is going to increase the risk for cardiac disease during pregnancy. If you have diabetes, if there is a history of diabetes, if you currently have diabetes, if you had diabetes in a previous pregnancy, these are risk factors for cardiac disease in pregnancy. And also if there's been a history of preeclampsia. So this is why it's important to know what your previous pregnancy was like, to understand what all went on in your previous pregnancy. All of that kind of rolls now forward to this pregnancy for being able to assess whether or not you are at risk for developing heart problems during pregnancy. The other is obesity, if you're overweight, if you're carrying twins or triplets, if there is any use of tobacco. When you're smoking tobacco, it will cause the blood vessels to constrict, decreasing the blood supply, making the heart having to pump harder and faster. So that is another. If there's any family history of cardiac or coronary disease, particularly if it started at an early age. And also your lifestyle. And that is going to be in terms of substance use, in terms of exercise. All of these things are contributory factors to heart disease during pregnancy. So as we look at all of this, the questions are, what can you do? As you prepare for your preconception visit, once again, you want to review and know your family history. You want to review your pregnancy history if you've had a pregnancy prior to this one. What happened? Was there any problems with your blood pressure during that pregnancy or previous pregnancies? Were you diagnosed with preeclampsia? You need to know your current history. What about your current weight? The next presentation we do is going to talk about weight gain during pregnancy. Know your current blood pressure. We talked about that in regard to being at risk for hypertension during pregnancy. Also, assess your lifestyle. Are you exercising? How much do you exercise? Are you smoking? Are you doing any substances? These are important things to know. So for anyone who is on, be happy to see any questions that could be in the chat box. If you have any questions of the presentation that's been done tonight, feel free to leave your comments. I'm happy to get back to you. I will ask you to like and subscribe to my channel. This week we will complete risk factors for complications that can occur in pregnancy resulting in maternal death. And we're going to also move to social issues to consider. We know that some of the social issues also impact causes for maternal death. So thank you again for joining with me. I look forward to talking with you again tomorrow. Thank you so much. Bye-bye.